Welcome back. Well, once again, today is Melanoma Monday, and we are here with a special guest in studio, Amy Pitwong with PeaceHealth Medical Center, to tell us more about what we need to be aware of when it comes to dealing with melanoma, because I think we hear about this a lot. We hear about getting checkups, sun safety, but what do we really need to know when it's all said and done? What's the best way to keep yourself and your loved ones safe?
I think it's important to have just kind of a lifestyle awareness when it comes to sun protection. It's hard if you follow these rigid rules to like sunscreen, shade. Those are things good to be aware of, but it's just having a conscious awareness going into sun protection. I enjoy the sun, I snowboard, I hike, but there's ways to do it where you're not completely just huddled in and avoiding it. You're still living your life. So sunscreen for sure is important. I would say being aware of the peak times of the sun. So that could be anywhere from 10 a.m. to 12 p.m. Till about 4. And that's when you kind of want to avoid it. Or if you're out there, being in the shade. And then one of the things I always tell my patients is you want to look like a beekeeper, basically. So wide brim hats, long sleeves that have UPF in it, long pants, sunglasses, and sunscreen to protect your skin. But that's not for everyone. Some people hate wearing hats. And so if you're a ball cap person, I say sunscreen your ears. If you don't like to wear hats, they have hairspray with sunscreen built in now. And so there are ways to enjoy your life and be out there, but be safe at the same time. If you don't like to do barriers, which are really the best way to avoid skin cancer, they have oral supplements like nicotinamide now that you can take that help reduce your risk of the non-melanoma skin cancers.
Well, so that's news to me, that last point. So what did you say it was, an oral supplement called?
Oral nicotinamide.
Oh, okay. So is that like over the counter?
Yep, it's available over the counter. There's a lot of studies that show that it decreases skin cancer risk by 20 to 30%. So having that part of the daily regimen, because it's hard to do all of those things.
Oh, absolutely.
So, just doing what you can.
Yeah, that really makes a big difference. And we talk about sunscreen. I always think this gets so difficult. You walk into the aisle, there's 1,000 different sunscreens, different materials, different SPFs, different UPFs, different acronyms. So what are we looking for ultimately if you're looking to get a sunscreen that's protecting?
Bare minimum, I always tell my patients to stick to mineral sunscreens, which will be zinc or titanium oxide. The minimum number you want is a 30, Ideally a little bit higher, but 30 would be the minimum when you're out there looking for these products.
Okay, that's good to know. So I think another point that always gets kind of difficult is, we just heard in that last story there, the idea of checking yourself head to toe for melanoma. What exactly are we looking for when it comes to giving yourself a self-exam for skin cancer? Yeah,
so there was the A, B, C, D, E's, but I think to keep it simple, change. Change is the thing I really emphasize with my patients. I tell them if they see something new that is irregular, symptomatic, just looks funky, that would be something to kind of keep on your radar. Just because it's new, though, doesn't necessarily mean it's concerning. So my rule of thumb is keep an eye on it for about a month to rule out that it's not a pimple, ingrown hair, bug bite. If it lingers beyond that, that's when you're like, maybe I should get another look. And also we have smartphones. Use that technology. Take a picture of it and then kind of timeline it, making sure you're keeping track of it. And if it continues to progress, that's when you want to send a message to your primary care or your dermatology provider and let them know that, hey, I think this needs a second look.
Yeah, that's a great point. Easier than ever to keep track of your own health with some of those tools. Well, that's fantastic. So for folks at home, any final tips before we head out? What is really the big takeaway that you want everyone to get at home to try to prevent any skin cancers?
I would say that just be aware, protect yourself when you can, still live your life, but just don't get any burns, really. Don't burn.
Yeah,
that's my big thing. Don't burn.
That's good to know. All right, thank you so much for coming on. We really appreciate it. Well, now we'll send it over to Brianna with a very, very sunny forecast, ironically enough, on this day.